So currently, we know that landscape in myeloma has clearly improved over the last 2 decades. We know that their prognosis has improved, but we still have a lot of work to do with the relapsed refractory multiple myeloma patients. And in those, we are using now CAR T cells. They are proving to be quite effective to rescuing many of them, but we still see a great many relapsed within the first 2 years. So it's important to find out how we can improve these outcomes, and for this we have tried to see if PET-CT, which has become an integral part of newly diagnosis, but for which we have no information yet whether it is useful in the relapsed refractory setting, or we also don't know whether achieving complete response by PET is useful or not for these patients. So that has been the aim of our work, and for this we assessed more than 60 patients that we treated at our center, and for which we did basal scans, but also assessments at 1 and 3 months after infusion. And this is how we tried to evaluate not only the state of whether the PET was positive or negative, but also several variables that we believe to be very useful, such as the presence of focal lesions, whether there is a high bone marrow uptake, whether there's paramedullary disease or even extramedullary disease. This last one being one of the most known adverse factors for patients with refractory multiple myeloma.